Ascariasis, caused by the parasitic roundworm Ascaris lumbricoides, has been known to affect humans for thousands of years. Evidence of Ascaris worm eggs has been found in archaeological samples dating back to ancient times. However, the scientific identification and understanding of Ascariasis as a specific parasitic infection occurred much later. The first clear description of the Ascaris worm is often attributed to the Italian physician and poet Francesco Redi in the 17th century. In 1684, Redi provided detailed descriptions of the worm in his work, which laid the groundwork for further scientific study and understanding of the parasite and the disease it causes. Throughout history, Ascariasis has been recognized and described in various forms, but it was the advancements in microscopy and medical science in the 17th and 18th centuries that allowed for a more accurate identification and understanding of the parasite and its life cycle. Ascariasis, a disease caused by the parasitic roundworm Ascaris lumbricoides, follows a distinctive route of infection that begins with contaminated soil. The eggs of Ascaris are passed in the feces of infected individuals and can mature into an infectious form if they contaminate the soil, particularly where feces are used as fertilizer. Infection occurs when these mature eggs are ingested. This typically happens through the consumption of fruits or vegetables that have not been adequately washed, cooked, or peeled and have come into contact with infected soil. It's also common in children who play in contaminated soil and then put their hands in their mouths without washing. Once ingested, the eggs travel to the small intestine, where they hatch into larvae. These larvae then penetrate the intestinal wall and enter the bloodstream or lymphatic system, making their way to the lungs. In the lungs, the larvae continue to grow and, after about 10–14 days, ascend the respiratory tract to the throat. Here, they are coughed up and swallowed, returning them to the small intestine. Back in the intestines, the larvae mature into adult worms, where they can live for 1–2 years. Female worms are prolific egg producers, and these eggs are passed out of the body in feces, potentially continuing the cycle if they reach suitable soil conditions. The prevention of Ascariasis heavily depends on good hygiene and sanitation practices. This includes using proper toilet facilities and ensuring that food is thoroughly washed and cooked, thereby breaking the cycle of infection. Ascariasis, an infection caused by the Ascaris lumbricoides worm, can lead to a range of symptoms, which vary based on the severity of the infection and the life cycle stage of the worm within the body. Many individuals with light infections may not experience any noticeable symptoms, but more pronounced cases can present distinct signs. During the intestinal phase, when adult worms reside in the intestines, symptoms can include abdominal discomfort or pain, nausea, and vomiting. In severe infections, there may be intestinal blockage or obstruction, and sometimes, visible worms can be observed in the stool. The lung phase, characterized by larval migration through the lungs, can cause respiratory symptoms. These include a dry cough or wheezing, shortness of breath, fever, and in some cases, blood-tinged sputum. Severe cases might lead to lung complications like pneumonia. General symptoms of Ascariasis, irrespective of the worm's life cycle stage, can include fatigue, weight loss or malnutrition, and in children, growth retardation. These symptoms are more common in chronic or heavy infections. It's important to recognize that these symptoms can overlap with other medical conditions. Therefore, diagnosis should be confirmed by a healthcare professional, usually through stool tests that identify the presence of Ascaris eggs or worms. The intensity of symptoms generally correlates with the number of worms present in the body, and heavy infestations can lead to more serious complications, such as life-threatening intestinal blockage. Ascariasis is treated primarily using antiparasitic medications, which are effective in eliminating the infection. The most common medications include albendazole, mebendazole, and ivermectin. Albendazole is often preferred for its ease of administration and effectiveness, typically given as a single dose. Mebendazole may be administered either as a single dose or over a course of a few days, depending on the severity of the infection. Ivermectin serves as an alternative, especially in scenarios where albendazole or mebendazole are not suitable or available. These medications function by targeting and killing the adult worms in the intestines. The dead worms are then expelled from the body through the feces. In cases of heavy infestation or if complications like intestinal blockage arise, more intensive medical interventions might be required. It's crucial to understand that these treatments, while effective in clearing the current infection, do not prevent future infections. Therefore, addressing the root causes, particularly poor sanitation and hygiene, is key to preventing reinfection. Preventive strategies include using proper toilet facilities, practicing good hand hygiene, especially after using the toilet and before handling food, and ensuring food is properly cooked and washed to avoid contamination with Ascaris eggs. Treatment should always be under the guidance of a healthcare professional, who can recommend the appropriate medication based on individual health conditions and local availability of drugs. In areas where Ascariasis is common, mass drug administration programs are sometimes conducted to reduce the overall incidence of the disease.